Live from Grand Junction, you're watching Midday.
Welcome back to Midday. Now, the peak of flu season is a little over, but there's still some sicknesses going around. Now, joining me is Will. Thank you so much with Mesa County Public Health.
Thanks so much for having me.
Tell us a little bit about what you do.
Yeah, absolutely. So my role is as an epidemiologist. We investigate reports of what are called reportable conditions. So certain illnesses are required to be notified when an individual tests positive at a clinic, hospital, or is seen by a healthcare provider. When they test positive, those results are required to be sent to us over at Mesa County Public Health so that we can call folks and ask them where they've been and hopefully try to prevent any other spread of illness.
And what kind of trends did you see this past season?
Absolutely. So during this past respiratory season, we saw vigorous flu and RSV activity alongside a more mild COVID-19 season. So since October 1st of 2024, we've seen 255 individuals be reported hospitalized related to one of those three illnesses. So the breakdown of those hospitalizations would be 77 COVID hospitalizations, 108 flu, and 70 RSV hospitalizations. So it's kind of an overview of this past respiratory season.
Okay, and why is there an emphasis on hospitalizations in particular?
Absolutely, that's a really great question. So individual cases of flu, COVID, and RSV are not actually reported to us at the health department, but rather specifically hospitalizations. The reason that is because we are monitoring how the illness spreads throughout the community and looking for its severity. So monitoring hospitalizations is actually a very good way for us to be able to keep an eye on which populations are being impacted the most.
Okay, and did you see a difference from 2024 to the previous year?
Absolutely. So this past respiratory season, we saw a shift in which of the viruses seemed to be hitting the hardest. So this past season, flu hospitalizations actually climbed to 108 compared to 87 from last year. COVID-19 saw a decrease this past year with 77 cases reported as hospitalized compared to 202 of last year. And then RSV is actually holding pretty steady at approximately 70 cases versus 78 from last year. So this is showing that COVID-19 had a more mild impact on hospitalizations this past year, especially in comparison to that increase in flu hospitalizations. But it's really a great opportunity and a reminder for folks that these illnesses all can result in serious health outcomes. So prevention is the most important thing, specifically vaccination and keeping our community healthy.
Absolutely. Is there anything that you're watching right now that people should be aware of?
Yeah, well, as we transition out of respiratory season and into the summer months, we do see upticks in different illnesses. So as we enter those summer months, we do see upticks in things like enteric diseases. Those are illnesses that cause vomiting and diarrhea. We also do see an uptick in mosquito-borne illnesses like West Nile virus. And lastly, as folks are out in recreating, we do also get more reports of animal bites, and the concern there would be rabies. So we work closely with Mesa County Animal Services to rule out any concern of rabies. So those would be the illnesses that we're keeping our eye on.
Okay. Anything that people can do to stay safe?
Absolutely. So prevention is something that we always recommend to everyone year-round, even if we aren't in respiratory season. So if you are not feeling well, to stay at home, away from others, and wash your hands, in particular after utilizing the restroom. And then if you are feeling ill and you're looking for testing, that is something that we can provide at Mesa County Public Health. So if you're interested in getting tested, give us a call and schedule an appointment.
Perfect. Okay, thank you so much.
Of course,
Good
thanks for having me.
We'll be right back.